My name is Franklin Makanga, Branch Secretary, Kenya Union of Clinical Officers, Mombasa. Our members have been out of work now. We are entering week 9, and they have not been able to address the issue of the statutory deductions. Also, the employer has resorted to threats and intimidations by even calling our members who are on leave to come back to work, and the sacking of the medical officers, 86 of them, who were sacked last week. This is our position as health workers unions, that we shall not bow to intimidation and the ways that the employer has now decided to use the unorthodox means of handling this issue is not welcome. And therefore we want to say that the doctors who have been sacked, we demand that they are reinstated to work so that this issue can be addressed amicably to ensure that services resume in this county. On the issue of politics that are being played by the COG by refusing to sign the return to work formulas that the nurses, the clinical officers, and the KMPDU have worked out through the multi-agency committee, we want to ask the COG to take responsibility and let them understand the current citizen or the normal mwananchi is suffering right now. Services have been disrupted all over Kenya, and this is the time that they offer leadership and do away with the cheap politics where they want to frustrate the healthcare workers. Further, we want to state very categorically that the intimidations, the dismissal letters that have been issued to our colleagues in Kisii County, we want to say that we as health workers unions, we shall not bow to those intimidations. And we want to ask all the 47 employers and the national government to be guided by law, because that is a provision in the Constitution. That in the Constitution, all state organs and officers shall be bound by the law. And therefore, let them not go ahead, try to intimidate people, issuing dismissal letters to people, which is against the law. This matter is before court, and they should wait for the court to pronounce themselves on this matter. It is not fair, and we don't welcome all those unlawful measures they have taken against our members. And lastly, I want to say this, that as healthcare workers in Mombasa County, we are very sad that the employer and the governor himself have not taken charge and responsibility over this issue. So the citizens of this country want to urge you, can you ask your political leaders in this country whom you elected to take responsibility and give you answers as to why in Mombasa County we have not been able to have healthcare services for the last over 70 days.
As my colleague has said, that for the employer, especially here in Mombasa and the Kisii County, to sack somebody who has sat in class for 6 good years in a sitting, in a meeting that did not even deliberate on the pertinent issues that are affecting health workers in Mombasa. It doesn't really add up for Mombasa County to dismiss doctors who have been who they have employed and have been trained by the same government for close to 6 to even up to 12 years, those who have specialized. So we are really astonished by the measures the county government is currently taking, instead of addressing the issues as they are, by holding the horn by its horn, the bull by its horns, so that they address the issues we have. We have actually very simple things that we've raised with the county government of Mombasa. Pay the remittances, and that is all. And call us for a negotiation, then we return back to work. But the measures you are taking are really unorthodox as it is, and we don't think that we will bow to your pressure. We will not bow to your pressure. We've engaged you for so long, since June last year, up to today. You know your weakness. You know what you have not been able to do. Take it up. The governor needs to come in. You cannot keep quiet for close to 2 months. The citizens of this country are suffering. They are not getting health services. People are dying in the villages. And the governor is so silent on this matter, and we know he can pile up pressure on this national government to release the funds they are talking about. 3 months in disbursement, which the national government has not really sent to the counties, is worth enough for them to even come and join us here, so that we can push this agenda forward as collectively as employer and the employees. Another thing, nationally, I believe the Council of Governors is actually letting us down. What does it take to compensate an employee who has died on duty? We are asking the national government and the Council of Governors to ensure that our colleagues who have succumbed, their families get compensated. That is it. And the risk allowance is worth for us to motivate us to go back to work. But when you are taking politics in place of performance of your towards the employees you are employed, it really makes us think that we made the wrong decision to elect you into office. And it's right time that the Kenyans think of this kinds of governance generally and do away with them come 2022 so that we can elect people who think well with about the citizens and the employees they have employed. We shall all be in solidarity until these issues are addressed. We are not going to let it go. We shall hold it strong until, even if it means 5 months like we did it in 2017, we shall.
National government and the county governments during this time of coronavirus pandemic. Health workers are our frontline soldiers during this unprecedented time of COVID-19. Therefore, as students of medical training college, we strongly ask the national government and the Ministry of Health and the county government to stop killing the dreams of medical students, to stop suppressing the health workers, and to stop suppressing the health of Kenyan citizens, and sort out the health quagmires in this country so that the thousands of students can study effectively and the medical finalist students who have their exams in the near future in 1 month time can access hospitals their clinical, for their clinical practices. Health is a very vital pillar in this, our beloved country, Kenya, and even the world at large. Without health workers, without medical students, without health workers in the hospital, we are all dead.
Comrades, power! Power! Comrades, power! Power! Comrades, tugul! Tugul! Comrades, tugul! Tugul! Comrades, te! Comrades, ria! Ria!
We were to do our rotations, our clinical practices before the COVID pandemic started. So for us, we are not supposed to go back to class tuanze kwanza kusoma tena theory. Tofaa kwa hospitali kuwa tupate hiyo experience and the nursing. For that, we need the nursing in charge. We need the nurses there. We need the staff. So if anything happens, tuwafata tukauliza, how does this go? Ama how are supposed to do this or do that? So kindly, please come to terms with the health workers. We need you. We have to finish this thing after staying home for a long time. You finally have to go back to school. Na hatufai kwenda class, tunafaa kwenda OC. What are we going to do there? Some of us are getting aged kwa sababu we have to finish. COVID imekuja, so everything ilisimama. Now that you're going to go back, how is this all commotion going to help us? So kindly come to terms with them so everything can be done.
And I want to address CS Mutahi Kagwe first. Mr. Mutahi Kagwe, somebody who did Bachelor of Business Administration. You don't understand anything about medical. You don't. Your work is to go to the hospital, remove your trouser, and we inject your hand.
Comrades, wisdom!
Wisdom!
Comrades, wisdom! Wisdom!
Now I want to tell him this. Please, with all due respect, look for Seth Panyako, talk with him so that the nurses can go back to work. Nurses are the backbone of the hospitals, ladies and gentlemen. And let me tell you this, for a matter of fact, Mutahi Kagwe does not understand anything. Hospitals are not for business. Our work is to treat and people to go home. As we treat, we also need to be paid handsomely, not just salaries or wages. We need to be paid handsomely. Those people who are at home, some are our mothers, some are our sisters, some are our girlfriends. Now you can imagine somebody like me. I'm living with my girlfriend who is employed. She doesn't have a salary. How do I live?
Comrades, power! Power!
Comrades cannot live like chicken. Comrades should eat chicken. Comrades, team him.
Team him.
This one goes to Joho. Please, Governor Alias and Joho. First, I want to talk about the bursaries. You cannot give somebody 5,000 and the school fees is 6,000. Sure. Why can't you just wire that money so that it can be in an account for pocket money? Huh? Other counties are giving bursaries 20,000, 30,000. You are giving us 5,000. We don't want. And for us comrades, we are not ready for BBI. Anything that we know that relates with I is STI and so on.
Utajua tujui nasikia utajua ujui lakini ujui. Yaani kikwaje? Unaweza tu acha tu.
Profession yako ni gani? Hapa. Mwanasiasa, daktari.
Bado mapambano, mapambano, mapambano. Bado mapambano. Wanafunzi msilale. Forever. Solidarity forever.
Lazima imagine kama ibada. Lazima.
Hapo sawa. Hapo sawa.
Bado. Power. Comrades, power. Power. Comrades, Tibim. Tibim. Comrades, Tialala. Tialala. Power. Comrades, power. Power. Comrades, Tibim. Tibim. Comrades, Tialala.